Hello, and welcome back to Find by Design, the podcast. I am here today with Dr. Sanda Moldovan. Did I say it right?
Moldovan.
Moldovan. It sounds much better when she says it. I am here with her today, and she is a periodontist, and she's a kind of a holistic one, doing a lot of natural work. Am I correct?
You are correct.
I know. I was like checking out her website, which we're going to put all that information in the show notes so you guys can check it out. But she has a whole lot of incredible stuff going on at her clinics. One of the things I loved was her anti-aging treatments she had, but she also talks a lot about the new things out in periodontal care. I want to talk to you about that today. What are some of the new things?
Right.
I know we talked about fluoride. We talked about toothpaste we're having our children use. Let's go to the fluoride first because I know that's a big topic.
Definitely. And so many dental offices are using fluoride for every single cleaning. I don't know if you remember, but I remember this. I have this vivid memory of this fluoride foam actually being put in the mouth, and then they tell you not to swallow. But how can you possibly not swallow? It's just very difficult. Fluoride is a pesticide, it's a chemical. It does not belong in ingesting it in the dental office. There's many other things we can do. Right now, especially, Janna, we're two states have banned fluoride in their water. And that's Utah and Florida. And I'm sure there's more to come. There's European countries don't add it to the water. And here's the problem. And I always say adding it to the water, when you add a drug to the water, you're not giving people the informed consent. And that's the whole point in modern medicine. We want to tell people, okay, what are the risks of ingesting fluoride? Whereas, if somebody goes to the tap water, drinks fluoride, they have no idea what the risks are because they haven't been told. And what are some of the risks? Calcification of the pineal gland, the third eye, weaker bones. We have studies actually done that on children between grade fifth and eighth who ingested fluoride, how through the water that they consumed in their communities, and they actually have a lower IQs. The higher the fluoride in the water, the lower the IQs in children.
Wow. But here's the thing, I knew fluoride wasn't good for you after I had used it many years for me and my children, but I never knew why it wasn't good for you. What's wrong with it? Because we would go in for specifically for fluoride treatments
Mhm.
as young kids in the 70s and 80s. Like they were throwing that fluoride around like it was free.
Exactly, because okay, the teaching in dental school is that fluoride decreases cavities, and that's really the whole goal. But what are we seeing? That the cavities are actually going up. And why are they going up is because children are being put on Ritalin, which dries out the mouth because of ADD. So a lot of the ADD medications can cause cavities indirectly. So in biological dentistry, which is what I practice, is let's look at the whole environment holistically. What can we do to balance the oral cavity and the mouth and give it what it needs, not like drugging it in order to get better results? So for somebody that has dry mouth, we would use calcium hydroxyapatite that actually mineralizes the teeth. It's a mineral that is actually found in our bones and in our teeth. So why not use that? We have good science that it works at mineralizing and strengthening the teeth more so than fluoride.
That's insane to me. I mean, I had no idea. There are some things too that, I mean, we did the best we could when we were younger and we didn't know as much as we know about dental care now. But we had our mouths filled with metal. Whenever we
Yes.
had a cavity, we filled it with metal. And tell us a little bit about what they're finding now. And for those of you who are running out to get them removed because they're not good, be careful. There is a good way to have them removed and a not so good way. The way that you have them removed
Mm,
really will affect your health. Tell us a little bit about that process.
yes. And I have to start with my own personal story. And that's what took me into practicing this way because I finished a traditional dental school 20 years ago. I went to periodontal residency, but I came into UCLA periodontal residency with 16 large mercury fillings in my mouth. And I said, oh, you know what? I'm in Hollywood. I want to have a nice smile. Let's remove them and give me a beautiful smile. So my friend in dental school did exactly that. Okay, let's remove them all 16 of them within a period of a couple of months. And I started not feeling well. And I didn't understand why at the time. I started having chronic fatigue. I couldn't go on my hikes and run in canyon. I had headaches and blurry vision. I'm like, what is happening with me? So I finally found a naturopath who did a urine challenge test for mercury and other heavy metals. And I remember talking to her and her saying, you know what, your mercury is off the charts. And I'm like, from what? She said, well, from those fillings that you had removed. And I was in so much shock when I heard that. I said, and then I got really upset. How can I go through a dental school and a residency program and no one mentioned this to me or for us to inform the patient? So then I started questioning everything that I learned. So I started diving deep into functional medicine. Okay, what else are we putting in our mouths as general dentists that maybe we shouldn't? What else are we doing from a periodontal perspective? Like we have this mouthwash called chlorhexidine. It's a pesticide. Yet most periodontists use this mouthwash as a prescription. And we have much better alternatives. So I really became so conscious because of my own pain that, and that whole toxicity with mercury took me 2 years to detoxify.
Great.
Mhm.
I'm super excited that we're talking about this because people don't understand that their mouth care, the health of their mouth, their gums, their teeth kind of is a really correlates to your entire health. So people are getting all these autoimmune diseases and inflammation and things like that. And you got things that I would think, maybe I'm getting the flu. What's happening? What's going on? They go back to your mouth health. So how do people get a good checkup on their mouth and their gums and where am I at?
Yes, that's a great question. I'm glad you asked that because if you go to a traditional dental office, they'll take the little small x rays and they focus on teeth. But biological dentistry focuses on the whole body. So in our office, we do a 3D CT scan because we know the small little dental x rays only diagnose about 52% of the problems, according to the studies we have. So we miss a lot of the issues. So a lot of my patients that come to me, they said, "Oh, this area is bothering me. My dentist said there's nothing wrong." And then when we take a 3D CT scan, it's like, "Oh my God, it's a big problem." We also do a saliva test to look to see, okay, what is the oral microbiome like? Is it causing someone to have chronic fatigue or inflammation in their body? Is it going to predispose them to Alzheimer's or Parkinson's? So we do a lot more deeper whole body prevention through the mouth in the way we practice.
So people who are listening are probably thinking, I want to get this mercury out of my mouth, as they should. I mean, you
Hmm.
don't want it in there. Having said that, what do you recommend to them? Because I did. I was having work and they just started taking them out. Then when I asked him, well, because I didn't like the way it looked, I had one
Yes.
quadrant left. And I asked him, why don't you do that? He goes, oh, we can't do that unless there's a problem because it could cause health issues. So we only remove it when there's a problem and we have to.
Yes. So there's actually a safe technique to remove these so called silver fillings. They're actually 50% mercury. And a lot of people might say, oh, you know what? They don't bother me. Why don't I just leave them alone? The problem is, and this has been shown, that mercury slowly comes off these fillings every day. When you brush your teeth, when you drink hot water, a little bit, microns every day comes off of there. There's actually a great smoking tooth video that it's very obvious how little it takes for this mercury to gas off the filling. The safe way to remove it is a technique that was published by IAOMT, which is the International Association for Oral Medicine and Toxicology. And they put a lot of effort into making sure that we're protected as dentists and assistants, but also you as a patient are protected. And this involves a lot of like draping and isolation of that tooth and actually having this big suction right in front to be able to suck off the vapor because it's the vapor that's odorless. When we cut into a filling, it fills up the room. And we've measured this. It can go up to 2,000 times higher than the EPA allows in the atmosphere. So if it's not sucked out properly, we inhale it. And that's where the toxicity comes from. And I think that's one of the reasons why in dentistry, we have one of the number one suicides because it's a neurotoxin. That's why I had the blurry vision and headaches. Uh, and if we don't know about it, we're just going to become toxic.
Wow. So I'm at my dentist and it's not you. And they say, look, you have some cavities we're going to refill. So we're going to remove those old ones and refill your cavities. What should I do? What questions do we ask our dentist to make sure? Because I still love my dentist. That doesn't mean I can't go get this work done somewhere else where they're properly trained to do it
Yes.
in a really holistic, healthy way. What questions should we be telling our dentist? Like, that's great, but I think I'm going to go somewhere else to have that part done.
Yeah, and I think it's really good for people to be informed and know exactly what goes in their body and their mouth, not just accept anything that the dentist has to offer. And I think the more educated people are and what questions to ask, the dentists are going to get more on board. Because my goal is really to transform dentistry into a healthier way, not just for people, but for the dentists and my community as well. Um, some of the things to ask is how do you remove the mercury? What kind of technique are you using? And people can go and get informed what a SMART technique is, SMART on the IOMT website. Do you use a rubber dam? Do you use a big suction? Do you use ozone for your procedures? We're big users of ozone in the dental practice because underneath the mercury fillings, there's always microbes. And now, if we're going to just go ahead and seal those microbes in with a new filling, with we can't see these microbes with the naked eye. They're 50 microns. So how do we know we remove them all? But ozone really removes all microbes, and it actually is not non-toxic to the tooth. Another question to ask is what kind of white filling am I going to get? Does it have BPA in it? There's actually a lot of BPA materials in dentistry. And what do we know about BPA? Is a carcinogen. Bisphenol A is a carcinogen, especially when we drink hot liquids. It leaches out. So there's great materials today that are BPA free. They're filled with nanoceramics coming from Europe that I recommend somebody ask for if they need to have fillings.
I never asked any of those questions. I mean, I just like, oh, it's white. Great. I
Yeah.
just assume they know. And here's the thing, we don't know what we don't know until we know it. And new things are coming out constantly. And so
Yes.
my dentist, bless his heart, is an older dentist. And so he probably doesn't have some of the cutting edge training that's coming out now, especially in holistic, because they're science based. They never
Yes.
even told you this while you were in school learning this.
Exactly. Yeah. So it's about learning after the fact and really caring about, the whole being, not just the mouth. Hmm.
I love it. I want to talk about because you're in Ageless Living LA, which we are so excited because we don't get to talk about this very often, dental care. And I think that the health of our gums and our mouth is key to so many things. And so I pay attention to mine, but clearly not enough because we don't know to ask these questions. Where can people really get educated on this? And do you have like a blogging site or somewhere where they can educate? Because I feel like knowledge is power. My mom used to say, if you get enough knowledge, it'll kill you. So sometimes it's okay to be dumb going through things. But for
Yeah.
me, knowledge is power when it comes to my health. I want to ask questions, I want to get answers. And I feel like when I had dental care, I had a break. So if I was told you're going to need 3 fillings, schedule it to come back. They never did it during that appointment. And so I had an opportunity that I missed to go home, research, and find out that information so I could call and ask questions
Yes.
before I went in.
Yes, absolutely. So, IAOMT is a great website. Also, on our website, beverlyhillsdentalhealth.com, we have great information and videos about procedures. I've also been very vocal about a healthier type of dentistry, biological dentistry, on my Instagram page, where I post videos and stories and science backed articles. The oral microbiome and the mouth is the gateway to our health. And it's the last place that people would look for answers. So most of my patients who come in have chronic fatigue, brain fog. They don't feel well. So there's not really an actual disease or label. They just don't feel well. And I'm very fortunate to work with integrative physicians in Los Angeles and Orange County that I detoxify the mouth from any kind of metals or microbes, and microbes from gum disease, from root canals that are maybe stuck in the jawbone, from cavitations, and people feel better. They have more energy. They can think clearer. But somebody with these symptoms would not think, oh, let me go to a biological dentist.
You know, two of my daughters doctors in natural medicine, and one of them, she hates lab. She's like, that's literally a picture of a moment. She always goes for saliva. studies. She's like, "You can find so much. The mouth has so much to talk to you. The saliva has so much to say that blood work we just don't see on blood work."
Yeah.
Because that's just a picture. I could do your blood in 6 hours after you had a meal or drink some water, or it's gonna look a little different. So,
Yes.
I love that you do that kind of testing for them.
Yes.
What are some of the other kind of testing that if I want to like, I'm really on a health kick and I wanna get better, and I know that Doctor Sonda just told me my mouth is key. Like, what are some of the tests that I could find an incredible like, she has a beautiful facility that's all set up and can answer all your questions, but if you're not close to her facility, what are some of the questions they can ask their doctors when they go in and says, "Look, I wanna make sure I have a clean mouth."
Yeah. The saliva test is one of the best ones because it's a foundation, it's the terrain, it's our soil for the teeth and gums. So it's a pretty easy test. I use a company called Oral DNA. I've used them for many years. It was started by a periodontist. Um, and it gives us a lot of information. It not only tests for the different kinds of microbes that might cause systemic problems, even affect fertility, for example.
Mm.
So it's anybody who has bleeding gums or recession, I recommend that test. And we also look for markers of inflammation for IL-6 to see how does the body respond to microbes. Is it really a intense response or maybe not as intense? This particular test can also do HPV to see maybe prevent like throat cancer. It does also sensitivity to gluten. It does quite a few things. So
I
yeah.
absolutely love it, and I feel like, are these tests that can be done through, they can send it into a lab and you can do a diagnostic on it?
So basically, the way it works, you do a swish, you spit in a test tube, and sometimes we can send it to people's homes, and they just ship it off, and we get a report.
That's why I was wondering for people who are listening who don't live close to the office, that
Mhm.
maybe they can say, "Look, I wanna be a patient, I wanna know what's going on with my mouth."
Yeah,
I just feel like nobody pays attention to their mouth unless it hurts. Like,
so true.
seriously, unless there's pain, I don't go.
Yeah, so true.
Or
But
they're going once a year for a cleaning, which again is kicking up a bunch of bacteria, a mess in the mouth, and so, I mean, how healthy is that actually getting your teeth cleaned?
yeah, and a good point. So what happens when we get our teeth cleaned? A lot of people actually like it, but a lot of people hate teeth cleanings because of the scraping. And scraping is such old
Yeah.
technology. I personally think that hygienists in general are too aggressive. I actually posted an article that one of my patients came in early 70s. Front teeth looked like hourglass, like little spaces in between. And then when I actually took an x-ray, both two front teeth were dead. And I call it death by curette because literally these hygienists scraped the tooth off until they killed the tooth over time. So now he's missing two front teeth. And that's because he was going to get a cleaning every 2 months for 40 years.
Oh, wow.
So it can be actually detrimental to scrape that hard. The Swiss came up with a technology called airflow that contains erythritol, and I love it because we're focusing on biofilm. So, what is biofilm? Stay. It's on the teeth, on the gums, on the tongue, and the cheeks. So, when we actually do a cleaning, we use this warm water spray with erythritol to wipe off the entire biofilm, not just scrape around the teeth. It has a much better effect if we look at science in decreasing inflammation and decreasing cavities because erythritol is anti-cavity. So to me, that's the way to do a dental biofilm therapy or cleaning, not with scrapers.
Well, Dr. Sande, tell people where your clinic is located so they can find it. But you guys, we're going to put all of this in our notes. So you can just go click on our website. We're going to put her social media information there so you can connect with her really quickly. But I'd love for you to tell us where they can find your clinic.
We have 3 locations today in Beverly Hills, Newport Beach, and Encino. And I'm very fortunate. I have an amazing team. Besides me, I'm the periodontist. We have another periodontist and 3 general biological dentists and a prosthodontist.
Well, thank you so much for being on the show today.
Thank you for having me, Jenna.